and the payment for June will also be done immediately. These ones are sorted out.
Federal government pays hazard and inducement allowances worth 4.5 billion naira to 31 federal teaching hospitals and medical centers. Northern governors take decisive action to contain the rising wave of insecurity in the country. Federal government to commence Batch C enrollment of NPower beneficiaries next month.
The government have to rise up, NGOs have to rise up, and then we need to all come together and fight this.
And as the world marks International Day for Elimination of Sexual Violence in Conflict, correspondent examines its economic impact and effect on victims. Good evening and welcome to NTA Network News. I am Jumma Yusuf. I am not alone tonight. Michael Olale is in Lagos Network Center. Felicia Dialop Samaila is in Jos, while Mohammed Ibrahim is standing by in our Maiduguri studio. Thanks for joining us. Nigeria has rejected the new levels of misrepresentation in the UK All-Party Parliamentary Group on International Religious Freedom Report on Nigeria launched a few days ago. The report, which also acknowledges the importance of accurate, unbiased, depoliticized and truthful information when it comes to understanding the realities in Nigeria. However, notes that when uncritical attention is afforded to critics with dubious intentions, it only becomes harder for both the government and people of Nigeria to engage in constructive dialogue in resolving differences and uphold what is enshrined in the Constitution. The federal government this Friday says it has expended close to 4.5 billion naira to 31 federal teaching and medical centers in the country on payment of hazard and inducement allowances for April and May this year. Minister of Labour and Employment Chris Ngige disclosed this after briefing President Muhammadu Buhari on the actions taken so far to halt the ongoing strike embarked on by members of the National Association of Resident Doctors earlier this week. State House correspondent Jide Onifade reports that the minister is optimistic that the National Association of Resident Doctors will soon call off the industrial action.
Minister of Labour and Employment, Dr. Chris Ngige, in company of the Minister of Health, Dr. Osage Hanire, and Minister of State for Labour and Employment, Festus Keyamo San, had briefed President Muhammadu Buhari on the strike by the National Association of Resident Doctors and actions taken leading to progress towards ending the strike.
In the payment, because we are paying them for the arrears of April and May. And the payment for June will also be done immediately. These ones are sorted out. So we have expended 4.5 billion as we speak this morning for these payments.
Ngige says the federal government will facilitate a meeting between the resident doctors and the Governors Forum to address the issues concerning state.
The issue of health is on the concurrent list. So the federal government will do their own, and the state governments are also expected to do their own. Some of their grievances are on what they feel that the state governments have not done.
Minister of Health Osage Hanire explains that the president was visibly unhappy considering the implications of the strike action at this time when all hands must be on deck to protect Nigerians from the coronavirus pandemic.
And what we have also urged the resident doctors to do is to have some trust in the system. This is a government, a regime that has always lived up to its expectations and always met its promise. And we hope that they will understand that the fight against COVID-19 in particular and the fight against all diseases in general is a collective responsibility of everybody. It is not just government as a person. We as medical professionals have an obligation on our own.
The association on Sunday had instructed its members to down tools over a shortage of personal protective equipment and poor remuneration for members as they battle the raging coronavirus pandemic. In the State House, Jide Onifade, NTA News.
Meanwhile, following the ongoing strike action by the Nigerian Association of Resident Doctors and ongoing reconciliation talks between union leaders and the government, Sarwal Khalid Ibrahim, who went around hospitals in the FCT, reports on the impact of the strike and all the matters arising.
The Minister of Health directed that all federal hospitals, or even all hospitals, should open a register for resident doctors who are supposed to be at work. And so we are here at the National Hospital to find out the situation. Activities at the National Hospital seem to be at the lowest ebb. Spokesperson of the hospital, Tayo Hastrop, says the resident doctor strike is still on, but their consultant and other professional health workers are attending to patients.
The resident doctors are attending to COVID-19 patients, as our hospital is an isolation center. They are still being faithful to it.
The Federal Medical Center, Abuja, also confirmed the ongoing strike. Chief Medical Director of the hospital, Professor Saad Ahmed, says they are yet to get any official directive from the Minister of Health.
We are actually running the clinics, even though there is a scale down on activities.
Some patients confirmed activities at the hospital.
No problem, they are attending us.
My appointment was yesterday, so it asked me to come today, so I saw the doctor. Everything went fine.
Meanwhile, resident doctors in the FCT have not joined the national strike action, as all hospitals under the Abuja hospital management are fully operational. Salwa Khalil Ibrahim, NTA News.
In the meantime, Lagos residents are appealing for a truce between the federal government and the National Association of Resident Doctors to urgently resolve the ongoing strike as COVID-19 cases spike up in the country. Hingino John Adams tells us more.
I'm standing right in front of the Lagos University Teaching Hospital, where patients are trooping in and out, an indication that activities are ongoing. But the activities are not as they used to be. They have been a little bit crippled by the ongoing strike. I have with me Ahmed, who will tell us what he observed inside.
In general, activities are going on there, but not really as active as I used to be, because I'm a resident of here, so I do come here often.
Why would they go on strike at this moment when people need them?
Sincerely, nobody wants strike. We don't want it. We are not going to withdraw all our members, all our services. Those are in the COVID center, and for the fact that we are in the pandemic period. So okay, we'll give consensus. We will allow those doctors who are in the isolation centers, to continue work for the next 2 weeks.
We are acting on emergency, both adults and children are still open, and we make do with those that we have around, and also we have admissions. So we have patients admitted on our wards, and we've had a meeting with the consultant 3 days ago, I think on Tuesday, 4 days ago, and we all agreed that we need to take care of those patients any time, continue to take care of them until they are discharged.
In Lagos, Hingino John Adams, NTA News.
Confirming Nigeria as a polio-free nation by August 2020 is gradually becoming a reality as the African Regional Commission for Certification of Polio Eradication, ARCC, accepts the country's wild polio virus-free documentation. Chairman of the ARCC, Professor Rose Leke, gave the indication at a meeting with the national team led by the Executive Director of the Nigeria National Primary Health Care Development Agency, Dr. Faisal Shahub, and partners. Professor Rose Leke stated that ARCC, which is an organ of the World Health Organization, WHO, has for the past years assessed the performance of the National Primary Health Care Development Agency. And joining us now to talk more about Nigerian status in polio is Dr. Faisal Shahub, Executive Director and CEO, National Primary Health Development Agency. Thank you so much for joining us.
Thank you very much for having me.
Docs, we've been having a backward-forward progress, in the certification process. Now we've been certified polio-free. How is it? What's the excitement about?
Oh, it's really an exciting time to be a Nigerian, to say for over 3 decades we've been on the same pathway to try and see how we can forever prevent any child from dying or being paralyzed from the wild polio virus. And then finally, yesterday, for all the evidences that we've presented, to be very clear to the African regional body of the WHO to say, yes, we're actually wild polio free. It's really elating, but at the same time, it's humbling because at this moment in time, we've really been standing on the shoulders of many heroes, many Nigerian heroes that in the last few years have been in the front lines, working hard to make sure that every single kid in Nigeria got 2 drops of oral polio vaccine. It's been many years of our traditional leaders providing leadership, especially in the last 10 years. But in the last 4 to 5 years, it's really been about how Mr. President has shown leadership, especially in 2016 when we suffered one of the setbacks that you've talked about. He really stood up, made the funds available, motivated health workers in the Federal Ministry of Health, the National Primary Healthcare Development Agency, all of the staff at the agency, our development partners, our donors, particularly Dr. Mr. Aliko Dangote and his foundation, Mr. Bill Gates, everybody coming together, making sure that for once in our lifetime, we're able to make sure that no child in Nigeria is paralyzed from polio. It's really, really amazing.
We were 3, Nigeria, Afghanistan, and India, and we sort of beat them to it. How can we maintain the status quo?
Right, we have to just not only do more of the same things, but actually raise the ante. We have lived through the last few years learning from all of the lessons of polio eradication, and one thing that this has brought us to the front of a real cutting-edge public health expertise. All of the lessons we've learned in the last 30 years is what we brought to bear to finish Ebola in 2014, and it is the same lessons that we've brought to our routine immunization program under this administration. See how we have progressively increased the coverage for routine immunization. We're beginning to work with our state governors who have been in the forefront of not only the polio eradication effort, but also strengthening primary healthcare. So we're not going to be complacent. We're going to use the same types of lessons around delivery, around ruthless execution, holding people accountable. That is what brought us here, and this is exactly what we're going to be doing in the next few years until we address some of the major issues that continue to bedevil us, the underfunding of primary healthcare, in the states and local government areas, making sure that people know for certain that you need to give your kids vaccines. You have to take them to the primary healthcare centers, secondary and actually tertiary healthcare centers, because vaccines do work. This is for the doubters, that vaccines
and all the
actually
controversies,
do work.
yes.
Absolutely.
So briefly, we're running out of time. Post-COVID-19, what next for polio?
We're just post-COVID-19, we're going to see a different world where maybe not so much of contacts will be required, but we're going to be even more careful, making sure that the health of our clients are protected, making sure that health workers are safeguarded and they feel confident that they can provide services without the fear of being infected by COVID-19. And that is why we're sort of restructuring and reimagining primary healthcare delivery. And we're excited about what the future holds. We know that these are difficult times for us because of the outbreak of COVID-19, but I'm sure we're going to get over this, and then we're going to look into a future where Nigerians will be very proud of the healthcare delivery that we've really laid out.
It's an exciting moment we're in now.
Absolutely.
Thank you so much, Dr. Faisal Shaiub, Executive Secretary, National Primary Healthcare Development Agency. It's been a pleasure having you.
Thank you for having me.
Thank you so much. We'll take a break now. We'll be right back. COVID-19 cases in Nigeria have surged past 18,000 as the United Kingdom lowers its coronavirus alert level after steady decrease in infections. Let's join Joyce Ometu for latest developments on the pandemic.
The World Health Organization (WHO) is warning that the global coronavirus pandemic is accelerating as 150,000 new cases were recorded on Thursday, the highest in a single day. Johns Hopkins University's latest count says there have been 8,639,987 COVID-19 cases globally. Out of the number, over 4.5 million patients have recovered, while 457,789 persons have died. The United Kingdom's chief medical officers have agreed to lower the country's coronavirus alert level from 4 to 3. This implies that the virus is still in general circulation, but transmission rate is reduced. However, the Joint Biosecurity Center warns that the move does not suggest the pandemic is over. In Honduras, President Juan Orlando became the latest world leader to be hospitalized after testing positive for COVID-19. His doctors said the president, though in a stable condition, would remain in hospital for treatment. And from China, a public health official said the current outbreak in Beijing is under control. However, few new cases were recorded. In Africa, statistics compiled by Worldometer as at 6 p.m. show that the continent has registered 280,748 infections, 7,492 deaths, and 130,938 recoveries. Back home in Nigeria, 745 new infections were recorded on Thursday, indicating the highest daily figure of confirmed cases as announced by the Nigeria Center for Disease Control. With the latest updates, the total number of infected persons in Nigeria has risen to 18,480, while 6,307 persons have recovered and 475 fatalities have been recorded. And that's a global update on COVID-19. Many thanks for watching. I am Joyce Ometu.
Thank you, Joyce. Now, providing safe spaces for management of COVID-19 patients as an effective strategy for managing cases has been proven to reduce fatalities, says the Minister of Health, Dr. Osage Henry, who recently inspected the 063 Nigerian Air Force Hospital, Abuja, operated by the Armed Forces of Nigeria as an isolation and treatment facility. Defense correspondent Najatu Tijani tells us more.
Upgraded from a regular outpatient ward to an isolation and treatment center with state-of-the-art equipment for the management of COVID-19 patients, the center meets NCDC control standards, notably in the areas of donning and disinfecting personal protective equipment, says Dr. Ehaniri.
Going to be very good. I've had the opportunity of visiting the hospital in Kaduna also, and the laboratory network that you have at Mogadishu Cantonment will also be part of what we can count as the total laboratory assets that we have in the entire country. We are working on creating a laboratory network, a national.
An initiative also advanced by the Ministry of Defense with support from the United States Military HIV Research Program.
There was a reference to the Defense Reference Laboratory earlier to provide testing that within the national system. So we work together, shoulder to shoulder, to make sure that we could help the response in the country.
Key players in the health sector say the implementation of a 3-year national health response plan will be a game changer in emergency response, which can be sustained in post-COVID-19 times. Najatu Tijani, NTA News.
The gift of good health is taken for granted by many people. However, some individuals are not fortunate as they are born with disorders they have to live with due to their genetic predisposition. Sickle cell is one of such. Uche Ogochukwu tells us more as the world marks Sickle Cell Awareness Day.
The prevalence of sickle cell traits ranges between 10 and 45% in parts of sub-Saharan Africa, with Nigeria recording about 20 to 30%. 39-year-old Mark and 19-year-old Hope are among the 2 to 3% of Nigeria's population with tales of excruciating bone pains, bacterial infections and anemia due to sickle cell disorder.
Get to have serious pains, excruciating pains really.
A lot of challenges, like now, my mates, they are ready for their exams, but I'm here.
Imagine you as a mother taking care of a child about 18, 19 years, cleaning her up, wearing her things, it's not easy. That this condition it's not her fault, it's not neither our own fault, because that at that time we're not exposed so much that we know to go and do tests, or genotype tests, all those things before we get married.
For them to prevent this crisis, we encourage them to avoid strenuous activity because that also predisposes them to crisis. For people that are in school, we don't allow them to do all the rigorous activities that happens in school. So that's another way they do to prevent it. They sleep under malaria-treated nets so that they won't have malaria infection. They try to keep themselves warm, especially during cold season.
Although Mark is not in serious condition as Hope, he appeals for legislation to assist sickle cell carriers in society.
I am a graduate, I am a civil servant, really, but a lot are not fortunate like some of us to be employed, and it's a tough one. Trying to manage to get drugs, trying to get finance to come to the hospital when in pains, and a lot of challenges, particularly when the complications as a result of the blood challenge starts coming. It's a tough one. We need help. Government needs to subsidize a lot of things for sufferers so that they can live up to their potentials.
World Sickle Cell Day aims at raising awareness about the disorder, which symptoms manifest from age 5 to 6 months. Uchi Ugochukwu, NTA News.
We'll take a break now. More reports when we return. Don't go away.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
Mama, Uncle Kim just called me. His wife just gave birth.